Well, I grew up in California. Went to college in the Bay Area, Stanford University, and then up to San Francisco to the University of California, San Francisco for medical school. And then ended up going way to the east to Boston Children's Hospital for pediatrics, mainly because I was very impressed with the program. It's one of the busiest and one of the oldest programs in the country for training pediatricians. And after 3 years there, I stayed another 3 years to become a newborn intensive care doctor. Neonatology is a 3-year fellowship after 3 years of pediatrics training. And then I was on staff in Boston for 3 years in an academic position as an instructor in pediatrics, working in research in the area of brain blood flow and protecting from brain injury in preterm babies. And then after about 3 years or so, one of my friends who had trained with me in Boston had moved back to Milwaukee, where he was from, and their group was looking for another newborn intensive care doctor. And about that time I had gotten married, started a family, and was kind of looking for a family-friendly place to settle. And turns out that having been on each coast, I decided the Midwest was the place to be. So that's how I ended up in Milwaukee. I joined Newborn Care Physicians of Southeast Wisconsin, which is a group of newborn intensive care doctors, and we provide services and consultations to the majority of the hospitals in the Milwaukee area. Neonatology is it's a subspecialty of pediatrics. It deals only with neonates, which is a word denoting newborns up to about a month of age or so. The majority of the babies that we take care of were born premature, but it also includes term babies who have various problems that could include birth defects or various respiratory problems, infections, other unexpected issues. Well, Columbia really specializes in taking care of healthy moms and babies and healthy pregnancies, and they try to minimize high risk here, which is great. I think they provide a wonderful birth experience. They will deliver late preterm babies here, although the obstetrician, my obstetrical colleagues, try very hard not to deliver very, very high risk patients here, because really those patients are better served at a level 3 center, a much more specialized center. So here at Columbia Center, we mainly see term babies who may have issues such as suspected infection or perhaps feeding difficulties or jaundice. We can also see late preterm babies, babies who are 35 weeks and up, term gestation being 40 weeks after the last menstrual period. So babies who are up to about 5 weeks early or so, we may see here. Occasionally there's a baby born here who unexpectedly has enough trouble that they really would be better served at a level 3 newborn intensive care unit. And then we would be the doctors who would come in, assess that baby, stabilize that baby, and assist in getting that baby to an appropriate center. I very much enjoy working at Columbia Center. I think the nurses here do a great job with all of the patients that they're presented with. They specialize in taking care of healthy moms and healthy babies and having nice normal deliveries where parents and families get lots of attention. But occasionally things don't go as expected, and then you have a baby who might need further investigation, might need specialized care, maybe needs IV therapy, maybe needs tube feedings, perhaps phototherapy. And our nursing staff here is quite capable in those areas also. We do have a schedule of doctors available 24/7 to provide services to Columbia Center if necessary. We also provide services to a number of hospitals in Milwaukee. We do a lot of in-house 24-hour call at the specialized level 3 centers. For the hospitals like Columbia Center, we're available 24/7 for consultation by telephone or on site if necessary. Not that often. We review all of our transfers out. It's actually, we do these reviews twice a year, and it's actually only a handful of cases every review. I came to the Midwest to raise my own family, and so now I have 3 boys of my own. The middle one, well, the first one was born in Boston, the middle one was born at St. Mary's downtown, and the third one was born right here at Columbia Center.